Endogenous pathogenic evils, we discuss endogenous dampness and endogenous dryness. Decline or loss of transportation, transformation, and distribution by the spleen often results in disturbed water and fluid metabolism. This in turn leads to retention of water and fluids. Since the retained water and fluids are not dispersed efficiently, they transform variously into dampness, phlegm, or rheum. This situation arises mostly because of spleen deficiency due to chronic illness or stomach injury due to excessive ingestion of foods that are raw and cold or fatty and sweet. The key defect leading to this abnormal state is the failure of water transportation and transformation by the spleen. Hence, the plain question states, and many dampness disorders are characterized by swelling and fullness. They are all related to the spleen. Dampness is characteristically heavy, turbid, viscous, and static. It readily blocks chi movement, though the effects vary in accordance with its location. If dampness is in the upper jaw, there are chest tightness and cough. In the middle jaw, epigastric and abdominal distension, poor appetite, and a thick and greasy tongue coating. And in the lower jaw, abdominal distension, diarrhea, and dysuria. If dampness is in the skin and in the interstitial spaces of the muscles, there is edema. It should be pointed out that though turbid dampness can encumber every part of the body, it is the spleen and the stomach in the middle jaw that are most often affected. Though there are differences between exogenous and endogenous dampness, the two often influence each other. When the external dampness pathogenic evil attacks, it often injures the spleen and compromises spleen functions. Loss of transportation and transformation by the spleen in turn leads to accumulation of endogenous turbid dampness. Hence, in clinical practice, whenever the spleen's functions are diminished, the susceptibility to exogenous dampness is increased. Now let's talk about endogenous dryness. When body fluids are insufficient, all the organs, tissues, and orifices of the body lose their moisture and nourishment. This in turn leads to the pathological changes of dehydration. That is to say, impairment of body fluids turns into dryness. There are many causes for this condition. Prolonged illness can damage yin and exhaust yin fluid. Profuse sweating, severe vomiting or diarrhea, and massive loss of blood or essence can all diminish yin and fluids. In other illnesses, the heat evil can injure yin, or the dampness evil can transform into dryness. The insufficient body fluids cannot adequately nourish the Zangfu viscera or moisten the interstitial spaces of the superficies and orifices, thus producing the pathological changes of the endogenous dryness syndrome. The clinical manifestations of fluid depletion include dry and rough skin, sometimes with scaling, clapped mucous membranes, dry mouth and throat, dry or denuded, cracked and red tongue, dry nose and eyes, brittle nails, constipation, scanty dark urine, dry cough without sputum, or blood-streaked sputum. Thank you for your attention.